It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox. We're back once again with another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that are changing people's lives.
Exactly right, Candace. You tuned in to the right program. We'll start it off with our first doctor, that is gynecologist Dr. Maurice Leibman.
I started having heavier periods where I would have to, make sure that I was near a restroom, and, kind of got to be about every hour to 2 hours, I would have to check, have excessive bleeding, and so I would not, wear anything that would, have the ability to, show any type of accident, which again is very embarrassing.
It's a very common problem. It affects about 1 in 5 women. A lot of women think they just have to put up with it, and that's part of being female, and sooner or later it will stop. But in fact it goes on for a long time, and it interferes with their work life, their exercise life, their sex life.
And it started getting irregular too. It wouldn't always be every 4 weeks. I mean, sometimes I would have it 3 weeks, sometimes 5 weeks, so I couldn't even anticipate if we were going on a trip or,
Again, in the old days, 10, 15 years ago, it was very common for the gynecologist to say, well, let's just do a hysterectomy. This new minimally invasive technology was developed called endometrial ablation, referring to ablating or removing the lining of the uterus.
And Dr. Leibman gave me the alternatives and said it's a very short procedure. I trust him wholeheartedly. I mean, I've known him for, 20 plus years, and I would trust my life with him.
She certainly didn't want to have a hysterectomy. So when we talked about this minimally invasive procedure that involved no cutting, no hormones, she was really interested.
And so came in here, cannot stand needles, cannot stand any procedures. I was in and out of here for sure in an hour. And I mean, obviously I did get put under.
The recovery is very similar. It's going home, taking a nap, having some pain medication, and usually that night there is some cramping. But the following day, almost everyone is up and about and doing what they need to do.
And went home, slept for maybe a day off and on, and I was back at work the next day. And ever since then, I've been perfect and feel wonderful.
After undergoing a mastectomy, Colleen turned to Dr. Evan Feldman to help change her life. To find out more about Colleen's story and other life-changing stories, log on to bestdocsnetwork.com.
After having met with Dr. Rose, toured the facility, and saw the importance of the work on the early detection side, I was compelled to do something more. It's kind of like once you have knowledge to do something, then you have to move forward and make sure that others know about it as well.
There are several things that we're looking for the foundation to do. One is to continue to fund important research. There's always going to be more things that we can learn and do better. The number 2 thing is to be able to educate both other physicians and the community, especially the community, so that people begin to understand and participate in the process of screening. Because the sad thing is, in recent years, screening mammography, especially in younger women, has decreased. And now I see women show up who haven't had their mammogram and they have more advanced tumors. I hate seeing that. We also want to try to be able to raise enough money to do more indigent care as well for those who need additional care. So those are the 3 main areas we're targeting.
What I love most is the fact that We're educating other radiologists to read these mammograms so that we can spread the word quickly, and also the amount of anxiety that the results of these tests provide.
Very few people really realize that almost all of the breast cancers are detected in the community. They're not detected at facilities like MD Anderson for the most part, because most people are referred with the diagnosis there. So the research foundation was based on that idea that we could fund research in the community and do things that weren't being done elsewhere.
Our work is so important. I feel that we can take a big bite out of breast cancer incidences if we can move forward with this early detection. Women who are vigilant about having their mammograms annually using a 3D tomosynthesis procedure can certainly help themselves. And not just for women who are insured, but we would like for every woman to have this available to them.
For those suffering from foot problems, our next doctor, podiatrist Dr. Gabriel Maislos, can help.
A bunion deformity is a deviation of the first metatarsal and the second metatarsal. So basically, you know, what people see of their big toe is this. So the big toe is pointing this way, and this bone is going out this way. When it's not matching up well, you get bone growth. And so bone starts to build up right here, and it also starts to build up top.
I spend about 85% of my time traveling, so I'm in and out of the airports. As a training manager, I do a lot of facilitation. So I'm on my feet a lot walking, and it got to the point where even flat shoes, what most people would think is comfortable shoes, became painful.
Her surgery was an awesome bunionectomy, but it was a little bit different because on the x-ray I discovered that she had severely arthritic joint. She had fracture fragments. So these fracture fragments never healed, and because they were constantly moving, it was severe pain. It caused an enormous amount of bone growth on the top and on the side. So I was really excited to do her surgery because I knew it would provide immediate relief.
I'll be wearing the boot for at least another 4 weeks, and then I'll come back for another reassessment. And then he'll determine then whether I can take the boot off and then just start walking in normal shoes.
People always ask, you know, why do I have this problem? And the biggest component is genetics. So if you look at your parents' feet or your grandparents' feet, it's basically telling you, if you see a bunion deformity, that your chances are your feet are going to develop these structural deformities. Then obviously for the females, it's wearing the high heels. You know, it's there's a price to pay for high fashion. You wear the high heel, it puts your foot in position, which predisposes you to a bunion deformity.
Well, I would love to be able to get back out there and be pain-free. A lot of times I couldn't wait for the day to end because I would be in so much pain. So I'm looking forward to being able to be on my feet for a longer period of times pain-free.
The look on the patient's face when they come in and they see the results and they're happy with the results, and they see that instead of having a crooked toe, or that it's actually straight, and that the pain that they had before is gone. So, you know, that's the rewarding part to me.
Meningitis can be a bad disease. There's 3 or 4 different kinds. The main kind is viral meningitis. That's relatively mild and doesn't really harm people, it just makes them sick for a while. Bacterial meningitis can be very bad. That's the one that can make you very, very sick, wind you up in the hospital, can even kill you. There's also things like fungal meningitis. This is the one that we recently heard about with the contaminated steroid shots. How do you tell if you have meningitis? Well, you have to be pretty sick to have meningitis. For example, your fever is usually pretty high, not low. Generally, you have the headache, usually described as the worst headache of your life. If you have a mild or moderate headache, that's one thing. If you have the worst headache that you've ever had in your life, then you gotta think meningitis. Also, you may have a rash, you may have a stiff neck, and generally people with meningitis just look horrible. So if you have a little bit of a headache and a little bit of a fever and feel a little bit horrible, that may just be a regular old virus. If it's real bad on the headache side and real bad on the fever side, then you got to think about meningitis and obviously
obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray.
With a gastric sleeve
without
operation,
really,
for example, he's going to lose the majority of the weight in the first year.
I went on, but then I started getting
You should see quite a bit of
and I was on
benefit in terms
antibiotics
of
for
how
4
his
months in a
joints
row.
feel, his ability
They
to
kept
bear
giving
weight,
me.
and the
So I
actual
was like,
loading
this
on
is
his
not good.
spine.
Before surgery is approved, Paul has to clear several tests. First, a visit with cardiologist Dr. Nasser.
So the purpose of the evaluation is
it's obstructed
make
by
sure
chronic inflammation, chronic
the heart muscles
infection.
in good
So
shape, the
we
valves in
offer
good
her
shape.
the option of
So
doing
from the
balloon
cardiovascular
sinuplasty.
standpoint,
The
we
best
do
part was
all
the
this
breathing. I could breathe again.
to tell
the headaches,
Marvin, the surgeon,
little by little started going
that your
away.
patient
Now when I sleep,
is in good shape,
I would breathe real loud.
and
My
we
husband will always
expect
say
no
that,
problems
and I don't do that no more.
from the cardiovascular
So when
standpoint.
you have a chronic
when it goes
sinus
to
disease, that passage
A comprehensive
is
sleep
obstructed.
study was
It's
then
narrowed
performed to
by
properly
chronic inflammation,
diagnose
chronic
his sleep
infection.
apnea.
So what we do is
service
we
for Paul
put a
because
small balloon in the
situation in
passage
which,
and we
his weight
open up,
and
we
always
inflate the
been a good
balloon,
person.
open up the natural
There are
passage,
some adverse
preserving
effects to
the
And
normal anatomy.
wanted to diagnose
And I don't sound like I
the
have
level of
colds
apnea
all the time.
that he may
Before
be
I was like
experiencing,
sick all
so
the time.
that
And now I'm doing
so that
great.
he
I
could
could
get
go
the
out,
proper
do everything, and I feel
for
good.
One of the
whatever
advantages
needs to
is the
happen. We
quick
just wanna make
recovery.
sure that we
There's really no
diagnose
downtime
everything
to balloon
get him where he needs to
sinuplasty.
be.
The procedure can be done
Paul
in the
was now
office,
cleared for the surgery
under
that would
local
forever
anesthesia,
change
with
his
topical
life.
Anesthesia with,
Well,
some
good morning.
nasal
I'm
spray.
here. It's about
There's
5:30 in
not
the
really
morning.
a
I'm getting
recovery
ready for my
time. Patient can,
pre-surgery
go
prep,
back
which
to her
starts
daily
in just a
activity
few
the next
minutes.
day.
My surgery starts at 7:30 a.m. and I've come here. I'm
surgery,
fixing to
which
meet with a
the
doctor in
recovery
just a few
can
minutes.
last
And
to,
I'm very
a
excited.
week.
You know, I'm looking forward to this day. You know, everyone has. We all make decisions where we look back on our lives and say, "I'm glad I did that," and I already know in advance it's going to be one of those decisions for me. Look back on my life a few years from now and say, I'm so glad I did this, and I'll always remember this day, October the 25th, 2012, when my life got better for infinitely.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Kimberly was born premature, so we had quite a bit of time in the hospital, about 6 weeks after birth. And it was about 2 weeks into that there was some discoloration to her left cheek and her lower lip. And that later started to grow, and we found that it was hemangioma.
Kimberly was born with a congenital hemangioma, which is a blood vessel tumor. It involved the skin of her face, and it also involved deep structures as well.
Coming to Dr. Eisemann and him explaining that it would be a process, but there would be a time that we really wouldn't be able to look at her and know the starting point with regards to the growth.
You know, we basically like to tell them in advance what we're planning on doing, and in her case, it's a staged procedure, and it was planned just that way. If you're trying to do too much at one time, you know, it can even be dangerous as far as the bleeding is concerned. So we tell them in the beginning that we're doing as much as we can at that time, and we probably removed maybe 20 to 30% of it, probably the first operation, and she's had 5 or 6 operations since.
I was excited because after all of this, I actually look like this. At first it was a lot, like all around my face, but it was, now that I look back at it, I'm actually really excited and happy.
There have been times that she came in after surgery that from the point of entry, we would hear, Kimberly's here, Kimberly's here, Kimberly's here. And people would come out, you know, and just, hi Kimberly, how are you, Kimberly? And that means so much, and especially for an 8 or 9-year-old who's bandaged from surgery, you know, it just goes without saying that his office staff is so supportive and so caring.
It makes me feel nice that he cares, or that he has, like, that he is nice enough to ask me how am I doing, or how is life going for me now.
Well, it's changed her life, you know. I can't imagine her going on life the way she was before without having had surgery. I don't think she can either.
I would say that people don't stare at me or talk about me or anything like that. They treat me nicely, and now I just feel really excited or happy to see that I can do all these things confidently because of Dr. Eisemann.
Don't forget, for more information on any of the great doctors you see on today's show, head to the website. It's bestdocsnetwork.com, bestdocsnetwork.com.
That's right, and now it's time to head to our next doctor, plastic surgeon Dr. Greg Bancroft, that talks about a special skincare line that he provides his patients.
Because of my history and being out in the sun a lot and not using sunscreen and not using glasses, I knew that I needed to do something and do a little bit as you get older. Then you're not dealing with a big mess when you're 60 or 70.
Due to her career that she worked previously, she enjoyed a good life where she worked at Club Meds around the world, but obviously you're going to get a lot of sun exposure, and with that sun exposure comes changes and disorder in the collagen and the pigmentation of the skin. You want to rejuvenate that skin, and then you want to protect it from further damage, and then you also want to even out the tone to kind of correct some of that sun damage that she's occurred over the years.
I came over and I talked to Dr. Bancroft, and he said, you know, I really think that my new cream that I've made in my compound pharmacy would really, really help you.
And in terms of the skincare products that we have here, we have basically a compounded cream where we're basically taking the cream and adding it to specific levels of the active ingredients for each patient. So you can have someone who has more of an issue with controlling pigment or needs more rejuvenation. You can work your way up to the level of Retin-A that's appropriate for that patient.
I started using the cream probably about 5 or 6 months ago and immediately noticed a difference with just the texture of my skin, the feel, the way that it looked, and the glow that it gave me.
You know, when you talk about things like sun protectant, that's the kind of stuff that's working from that point forward. But those damages that you've had, those fine lines, those wrinkles, the pigment, the age spots, those kind of things, obviously the ingredients in the skincare products we use can help even out the skin tone for that. And then the rejuvenating component will build more collagen, build more proteaminoglycans, other protein structures within the skin. As you get those built up, they allow your skin to hang on to moisture better. Skin that hangs on to moisture better will appear plumper. Skin that is plumper won't have those fine lines that people complain about, and so it really will start to freshen and turn the skin around so it can look better.
You look so youthful, your skin's glowing, and I call it the magic cream. So I let people that have asked me know that I've been seeing Dr. Bancroft and that he has this wonderful cream that I call the magic cream that has worked magically on me. And several of my friends have come here and are using it and have noticed a great difference as well. So it's a lot of fun.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage in that they were decayed. And he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth. And George is a very outgoing person and likes to smile and has a great smile. And so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing, particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, many individuals decide to maybe focus in one jaw versus the other. Now granted, with him we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and complete it in one day. Reality is the final is usually done later down the road once the body has fused to the implants, and the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
Up next, we'll meet Dr. C.T. Nguyen, who helps individuals suffering from sinus problems with a unique procedure called balloon sinuplasty.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have cold all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
12-year-old Kyle loves to play baseball, but it was hard to do due to allergies. That is until he met Dr. Lynn Dickens. To find out more about Kyle's story and other life-changing stories, log on to bestdocsnetwork.com.
Well, from the standpoint of non-invasive treatments to the face, such as the Botox, that helps reduce the wrinkles. So you want to prevent them before they actually establish them themselves long term. So that's what the Botox is going to do. It's going to paralyze those muscles that cause the wrinkles. Therefore, you don't get the wrinkles.
Botox is more for like the fine lines that I have around my eyes or my forehead, or especially, in the zone where we make the little snooty face. And over time, the creases get worse.
In addition, anybody who has the aging process, which is the natural creases or folds in their face, that's where the filler can come in.
The filler I come in for my lips, just to soften the area right here where it starts to wrinkle. That didn't happen until after my mid-30s. I started getting a little fine lines around my lips. So she came in, it's really not to have big lips, it's just to soften this area. And in my folds right here.
There are different types of fillers on the market now. The most common is a hyaluronic acid type filler, which means it is a protein that's normally found inside the skin. And by injecting this type of filler, it attracts water to the area and therefore plumps the area out.
If I get a Botox procedure, I can come in on my lunch break. It's very quick. I can go back to work. I don't look crazy or weird.
Anybody can be a good candidate for Botox and fillers as long as they're not on any blood thinners, okay? Or if they have any allergies to any specific medications, such as the Botox or the fillers.
I believe the non-invasive route is the better route, and then if that doesn't help, then you may have to have some type of plastic surgery done. But there's all kind of things that you can do now between the lasers and the chemical pills and really good products and injectables. I believe that you can do a lot and you don't have to so far go as far as getting cut on. Mine is to really look refreshed and, you know, nice. I'm not trying to look 20, I just want to age gracefully.
Are you having trouble sleeping? Do you wake up rested? Sleep is important. It's a time when we consolidate memory, we resolve conflicts, and we rest those aching bones and muscles and help our mind get back to normal from the wear and tear of the day before. So what's the best way to get a good night's sleep? First of all, avoid caffeine after 5 or 6 p.m. in the evening. Avoid alcohol near bedtime. Although it may make you feel sleepy, you're not getting quality sleep when you drink alcohol. And you're also not getting all those things about consolidating memory and resolving conflict when you drink alcohol to help you get relaxed to sleep. There's lots of medications for helping you sleep. However, the prescription medicines are ones that should not be taken on a regular basis. They can become a little bit habit-forming. Some of the best medications for being able to sleep are the antihistamines that you can buy over the counter. There's many brand names and they work in a wonderful way. Plus, you don't get addicted to them. So have a good night's sleep. Don't snore too loud, and exercise regularly. That'll help you sleep a lot better.
People go for snoring, but they need to figure out if they're treating snoring, if they're treating a real medical problem, like sleep apnea, so that they treat the cause of their snoring instead of the noise.
Dr. Ludwick's in-house state-of-the-art sleep lab allows him the opportunity to evaluate his patients in a comfortable setting.
Well, people don't come see me for a test, okay? They come see me because they feel a certain way, and they don't want to feel that way anymore, or they don't want to have this symptom like snoring anymore. They don't. Testing is a means to an end. It's a means to understand what is going on with you so that I know how to treat you, okay? So we have to have the test to know if I'm treating someone who just makes a noise or someone who actually has a medical condition that causes heart attacks and strokes, and as you saw in the nightly news, if you watch the nightly news, increased chance of cancer now. So it's a real medical problem. So I do the testing. The testing is necessary for the treatment, okay? Once we decide that you need treatment, let's say for sleep apnea, then we got to figure out how we're going to treat you. There's lots of different treatment options. There's surgical ways to treat sleep apnea. There's non-surgical ways, and it just depends on the person, their anatomy, and their overall health status. Which way that we want to help them. And the good thing about coming to an ENT that does sleep is that sleep apnea is an upper airway problem. It's not a lung problem. Okay, you don't have a lung problem. You have a can't get the air to your lung problem. Yeah, and so that's why it's good to go to an ENT, because then we can address all the anatomic issues you may be having, because these guys have other things like deviated septums or big turbinates or big tonsils or huge palates, big tongues, things that we can help surgically manipulate those structures so that they're not causing obstruction, or if they are causing obstruction, cause less obstruction. And that's the benefit. And also use these other non-surgical techniques like CPAP or oral appliances or things like that.
From initial testing and evaluation to a successful treatment plan, Dr. Ludwick provides his patients with a one-stop solution.
That's the purpose of us building a relationship. It's not something we fix in one visit, it's a journey, We're gonna evaluate you, find out what the problem is, pick some options, and let's see how you do. And then we can always change the plan. It's not written in stone.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that are helping to change people's lives.
And the good news, Candace, for more information on any of these great doctors you've seen on today's program, everybody can head to the website, bestdocsnetwork.com.
Absolutely. And if you have a question or comment for us, or if you have a doctor that has helped to change your life, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.